The process by which bone is formed is called ossification or osteogenesis. Ossification occurs in 4 principal occasions across the lifespan. The initial formation of bones in an embryo and fetus, during the growth of bones during infancy, childhood, and adolescence, during bone remodeling, which is a continual replacement of old bone tissue by new bone tissue, and during the repair of fractures or breaks in the bone. Now, the initial formation of bone and bone growth across infancy, childhood, and adolescence will be the focus of this video recording. The process of bone remodeling and fracture repair will be discussed shortly. So the embryonic skeleton, or the skeleton of a baby who has not yet been born, is initially made up of mesenchyme in the general shape of bone. During the 6th week of development, the mesenchyme begins the process of ossification. During this time, there are 2 processes by which bone is formed. Intramembranous ossification, where bone forms directly within the mesenchyme, so intramembranous, within the membrane of the mesenchyme. And then endochondral ossification, where bone forms within the hyaline cartilage that develops from the mesenchyme, with endochondral within the cartilage. These 2 processes, which both involve the replacement of a pre-existing connective tissue with bone, do not lead to any differences in the structure of a mature adult bone, but are simply different methods by which bone can develop. So taking a look at intramembranous ossification first, and this type of ossification is the development of bone directly from mesenchyme. Intramembranous ossification occurs in our flat bones, such as the bones of our skull, sternum, ribs, and clavicle. This process begins with the development of an ossification centre, which is simply the site where bone begins to develop. Specific chemical messages cause the cells of the mesenchyme to cluster together and to differentiate, first into osteoprogenitor cells and then into osteoblasts. Osteoblasts then secrete osteoid until they're surrounded by it, at which point these cells are now called osteocytes. Next, the secretion of osteoid stops, and the osteocytes sitting within their lacunae extend their little processes or arms out into the caniculi, or the tunnels, which radiate out in all directions. Over the next few days, calcium and phosphate from the blood will be delivered to the extracellular matrix, where they combine to form crystals of hydroxyapatite, which are then deposited into the extracellular matrix, hardening or calcifying the tissue. As the bone extracellular matrix forms and hardens, it develops into trabeculae that fuse with one another to form spongy bone around the network of blood vessels in the tissue. Connective tissue associated with the blood vessels in the trabeculae differentiate into red bone marrow. In conjunction with the formation of trabeculae, the mesenchyme condenses at the periphery or the outskirts of the bone, and it develops into our periosteum. Eventually, a thin layer of compact bone will replace the surface layers of spongy bone, although the spongy bone remains in the centre. Over time, and once a baby is born and then grows, much of this newly formed bone is remodelled, so destroyed and then reformed. This occurs as the bone is transformed and grows into its normal adult size and shape. So to give you a bit of a break from all of that text, here is that same process but in the form of a figure. So the first step in intramembranous ossification is the development of the ossification centre, where the mesenchymal cells will cluster together. They then differentiate into our osteoprogenitor cells and then our osteoblasts. Our osteoblasts will then secrete osteoid until it completely surrounds the cell. At this point, we then call the cell the osteocyte, and the secretion of osteoid stops. Calcium and phosphate are then delivered to the area via the channels that carry the blood vessels and the extracellular fluid in the caniculi. Hydroxyapatite crystals form, and then they're deposited into the extracellular matrix, or that network of collagen fibres, which then hardens and calcifies the tissue. As that extracellular matrix forms and calcifies, it begins to form our trabeculae and the spongy bone around that network of vessels in the bone tissue. The connective tissues around those blood vessels then begin to form the red bone marrow. Lastly, on the surface of the bone, our periosteum will begin to develop. Underneath our periosteum, compact bone will replace our spongy bone. Endochondral ossification is then the replacement of cartilage by bone. So our mesenchymal cells first differentiate into hyaline cartilage, which then develops into bone. All of the bones of the body undergo endochondral ossification, except for our flat bones, which, as we just spoke about, form via our intramembranous ossification. So endochondral ossification begins with the development of a cartilage model. At the site where bone is going to form, specific chemical messages cause those mesenchymal cells to crowd together in the general shape of the future bone, and then develop into chondroblasts. The chondroblasts secrete cartilage extracellular matrix, producing a cartilage model of the bone made up of hyaline cartilage. A covering called the perichondrium, which is just an outer layer of cartilage, develops around the cartilage model. Once the chondroblasts become deeply buried in the cartilage extracellular matrix, much like our osteocytes, we now call these cells chondrocytes. The cartilage model then begins to grow in length due to the continual cell division of the chondrocytes and the further secretion of the cartilage extracellular matrix. As the cartilage model continues to grow, our chondrocytes can also hypertrophy or increase in size. And towards the end of this process, some of the cartilage extracellular matrix begins to calcify. As a result, some of the chondrocytes will die because the nutrients can no longer diffuse as easily through the extracellular matrix. As these chondrocytes die, the spaces left behind by the dead chondrocytes merge into small cavities called lacunae. Primary ossification, which is just that first site of ossification, then proceeds inward from the external surface of the bone. A nutrient artery, which is simply the artery which supplies a bone, penetrates the perichondrium and the calcifying cartilage model, and it stimulates osteoprogenitor cells in the perichondrium to differentiate into osteoblasts, which then eventually form our periosteum. Near the middle of the bone, capillaries from the periosteum will grow into that disintegrating calcified cartilage, inducing the growth of our primary ossification centre, where bone tissue replaces most of the cartilage. Osteoblasts then begin to deposit that bone cellular matrix or the osteoid over the remnants of the calcified cartilage model, forming our spongy bone trabeculae. Primary ossification then spreads from this central location towards the ends or the epiphyses of that cartilage model. As this primary ossification centre grows towards the ends of a bone, osteoclasts break down some of that newly formed spongy bone tissue, leaving a hollow space called the medullary cavity. Eventually, most of the spongy bone surrounding the medullary cavity will be replaced with compact bone. Blood vessels will then enter the epiphyses or the ends of the bone, and secondary ossification centres will develop, usually around the time of birth. Bone formation is similar to what occurs in the primary ossification centre. However, in the epiphyses of the bone, no medullary cavity is formed, so that spongy bone tissue remains. And in primary ossification, where the ossification moves inward, with secondary ossification, it moves outwards towards the outsides of those epiphyses. Lastly, the hyaline cartilage that covers the epiphyses or the ends of the bone become our articular cartilage. And prior to adulthood, hyaline cartilage, which remains between the diaphyses and the epiphyses, becomes our epiphyseal or our growth plate, which is the region responsible for the lengthwise growth of the long bones. So once more, looking at that process but in figure form. And in our first step up here, the mesenchyme will differentiate into chondroblasts, forming this hyaline cartilage model. A covering called the perichondrium will surround that cartilage model. The cartilage model then begins to grow through both cell division and hypertrophy of our chondrocytes or cartilage cells. In the centre of our cartilage model, some of that cartilage extracellular matrix begins to calcify. A nutrient artery, or the artery that supplies the bone, will then penetrate the perichondrium. This stimulates the transformation of our perichondrium into our periosteum. Capillaries from the periosteum will then go in towards the bone and start to replace the cartilage with the bone tissue, forming our primary ossification centre. As this primary ossification centre begins to spread towards the end of the epiphyses of the bone, osteoclasts start to break down some of that newly formed spongy bone tissue, creating our medullary cavity. Blood vessels then enter the epiphyses of the bone and stimulate the development of our secondary ossification centre, where spongy bone continues to replace the cartilage. The hyaline cartilage that remains around the ends of the epiphyses becomes our articular cartilage, which, remember, is the cartilage that is formed in a joint where two bones will meet. The hyaline cartilage at the metaphyses, which, remember, is that region between the epiphyses and the diaphyses, becomes our growth plate or our epiphyseal plate. And this is where a bone grows in length until a person reaches adulthood. So beyond birth into infancy, childhood, and adolescence, bones will continue to grow in length. We call this interstitial growth. They can also grow in thickness, which we call appositional growth. So the growth of a bone in length involves two major events: the growth of cartilage on the epiphyseal side of the epiphyseal plate, so the side of the epiphysis closest to the end of the bone, and then at the same time, the replacement of cartilage on the diaphyseal side of the epiphyseal plate by bone through endochondral ossification. So this occurs on the side closest to the diaphysis or the shaft of a bone. Now, to understand this process, which I will explain in more detail shortly, we need to know a bit more about the structure of the epiphyseal plate. So the epiphyseal plate, also known as the growth plate, is a layer of hyaline cartilage in the metaphysis of a growing bone that consists of 4 zones of cartilage. Looking at this figure here, this is an X-ray. We've got your feet. So lots of different cartilage cells in 1, 2, 3, 4 different zones. So looking at that zones, and first we have the zone of resting cartilage, which is closest to the epiphysis or the end of the bone. So it would be this section that kind of sits on this side here. And it consists of small scattered chondrocytes or cartilage cells. And the term resting is used because the cells in this zone do not participate in bone growth. Rather, they anchor the epiphyseal plate to the epiphysis of the bone. Moving towards the diaphysis, so now we're moving closer towards the shaft of the femur here. This is the zone of proliferating cartilage. So here, slightly larger cartilage cells are arranged a bit like a stack of coins. These cartilage cells undergo interstitial growth as they divide and secrete extracellular matrix, which lengthens this region of cartilage. The chondrocytes produced in this region replace those that die at the diaphyseal side of the epiphyseal plate when they eventually turn into bone. We then have the zone of hypertrophic cartilage. So again, we're still moving towards the diaphysis or the shaft of the bone. And here we have larger maturing chondrocytes, which are also arranged in columns. And here, as the name suggests, the chondrocytes hypertrophy or increase in size, also increasing this region of cartilage. Lastly, we have the zone of calcified cartilage, which is the final zone of the epiphyseal plate, and it's closest to the diaphysis or the shaft of the bone. And this zone is only a few cells thick and consists mostly of chondrocytes that are dead because the extracellular matrix around them has been calcified. Osteoclasts then begin to break down the calcified cartilage, and osteoblasts will begin to replace the calcified cartilage with bone via endochondral ossification. So in terms of what that looks like for growth, so interstitial growth at the epiphyseal plate is the only way that a bone can grow in length. As a bone grows, the chondrocytes will proliferate or divide and make more on the epiphyseal side of the epiphyseal plate. So if we have a look here, this is our epiphysis, this is our diaphysis. This purple line here is our zone of proliferating cartilage, where we're making more and more of those cartilage cells. The new chondrocytes replace older ones which have grown in size. So that's this green zone here, the zone of hypertrophic cartilage, where those mature chondrocytes will increase in size. These increased in size cartilage cells are then destroyed in this white zone here by calcification. And that cartilage is then calcified and replaced by bone on this diaphyseal side. So in essence, this diaphysis of the bone moves out this way to increase the length of the bone. We have the zone that anchors the epiphysis to the epiphyseal plate, the zone where we make more cartilage cells, the zone where these cartilage cells increase in size, and then the zone where that cartilage is replaced by bone. Now, when adolescence comes to an end, about 18 years of age in females and 21 in males, these epiphyseal plates will close. That is, the epiphyseal cartilage cells will stop dividing and bone replaces all of the remaining cartilage cells. The epiphyseal plate fades and it leaves a bony structure called the epiphyseal line. With the disappearance of the epiphyseal plate, bone growth in length completely stops. So a bone can no longer get any longer. Bone can then grow in thickness or diameter via appositional growth. So at the bone surface, cells of the periosteum will differentiate into osteoblasts, which secrete osteoid. The osteoblasts become surrounded by the extracellular matrix and develop into our osteocytes. At the same time as this new bone tissue is then being deposited or built on the outside of a bone, osteoclasts on the inside of the bone, which line that medullary cavity, are eating away at the bone tissue, so that the size of the medullary cavity increases as the bone increases in thickness or diameter, so that this thickness of the bone here stays pretty much the same size. So on the outside, on our periosteum, we have osteoblasts secreting osteoid, increasing the thickness of the bone here. At the same time, we have the osteoclasts lining the medullary cavity, or the inside of the bone, eating away at that bone tissue, so this thickness here remains relatively the same.